Good afternoon, everyone. Welcome back on this session. Happy International Women Day to all once again. Today, we gather to celebrate the achievements, to celebrate the cultural, political, and socio-economical achievements of women. We also gather here to raise awareness for women's equality and gender parity. In the same context, I would like to extend our warm welcome to our speaker and guest, Dr. Manishika, Women's Health Physiotherapist, Fortis Shalimar Bagh, New Delhi. I would like to extend warm welcome on behalf of Dolphin PG Institute of Biomedical and Natural Sciences and IAP Women's Cell Uttarakhand branch. I would like to welcome you, ma'am, and now, without wasting much of time, I would like to share the screen with you so that you can start your lecture on your topic. Welcome, ma'am.
Thank you, Dr. Deepti. I'm Dr. Manishika, and um, I'm a physiotherapist. I'm a women's physiotherapist. I'm an internationally certified childbirth educator, and today we're going to talk about that what our role is as a physiotherapist in pregnancy and labor. Definitely, this is a vast topic, and today we are gonna give an overview. We are gonna talk about it in a brief that what all things we can do in this part. Before starting this, I would like to congratulate all the women out there and a very happy Women's Day to everyone. So, when we talk about the role of physiotherapy in pregnancy and labor, yes, it is a big role and a great role. Before that, it is very important for us to understand what an anatomy of pregnancy and labor is. So, moving forward with our next slide, let's talk about the anatomy of our pregnancy. So, as you can see on the slide, I think we can go with slides only. This is the fundus. Here is a baby. Baby is attached with a placenta in the uterus. This is the mouth of this uterus, which is called as cervix. It's an anal opening. This mouth of uterus, it opens in the vaginal opening, and this is the bladder. Now, if we see the bladder is resting, the bladder is resting above the pubic bone, and the baby is resting on the bladder. So, what happens over here is that in pregnancy, a woman tends to go to urinate again and again. She has this feeling of passing urine again and again, right? So, here comes our first thing, that's Kegel. It's extremely important in pregnancy. Second, as when the baby progresses and the labor begins, and when the baby progresses in labor, baby usually comes down this way, right? So when the baby comes down this way, what usually happens is there is a lots of pressure on our anal opening. So that's the time when the mother says that she has a feeling of pooping. So by this, information, we can actually help the mother to know that where she is, and we can help them and guide them that what she's supposed to do. It is very important to understand the position of placenta if in case we're starting with pregnancy exercises. So as you can see, this is the baby. Baby is attached via the cord, that's umbilical cord, and this is the placenta. The position of placenta in uterus is important. Low placenta, placenta previa, or high placenta, which we will talk later. Let's move further. So, this is the anatomy before and after pregnancy. We can see that the uterus is small, it's fist size, but as the mother is full term, the uterus is about 500 times than its size. Right, so what is happening over here? There's lots of pressure on the pubic bone, the back, there's anterior tilting of pelvis, there's lots of pressure on the abdominal viscera. They all have shifted up, and mother definitely have lots of discomforts, nauseas, at times acidity, or digestive dysfunctions. This is what happens. So, when we talk about it, in a pregnant body, the shoulders, they either goes forward, rounded shoulders, or they can go into hyperextension. Right. Second, there's lots of lordotic curve over here and anterior tilting of spine happens. The entire weight it shifts towards forward, right? Because there's a growing belly, there's a baby inside, so the entire weight it shifts forward. So what happens over here is that it's very important for us to see what we have to correct. We have to teach the woman about the proper posture. If the woman is going for forward rounded shoulder, it's very important for us to stretch the shoulders back. If the neck, she's going for forward headed posture, it is very important to teach the backward, the correct alignment of the neck. If the mother is going towards anterior tilting, that's there's increase in the lordotic curvature, it is very important to focus on the back strengthening of the woman. It's the power of women to nurture a baby and to grow a baby inside, and as well as it is very important to support and love the woman at the same time. So this usually what happens over here. So in this slide we can see there are lots of strain on the pelvic ligament and pelvic joints. Before moving further and understanding the exercises, let's talk about the structure of our pelvis. This is the pubic bone, right? This is sacrum, that's the tailbone. Pelvis, pubic bone, sacrum. This is what is holding the baby above it. So baby, when the mother is pregnant, is floating somewhere here. Baby is not engaged in the pelvis as of now. When the labor begins, at that time, the baby usually engages in the pelvis, right? So what happens is that usually, let's understand the movement. This is the tailbone, right? When it shifts up, the tail moves out, the bone moves in. When the bone moves in, this entire pelvic inlet, it decreases, right? Pelvis, this is pelvic inlet, this is pelvic outlet. Inlet in terms of baby, baby moves down this way and it gets delivered through this way. Okay, so what happens is when the mother's position, it is more of anterior tilting or what we called as nutation, everything comes like this. The space, pelvic inlet, it decreases. At the time of labor, if this decreases, it becomes very difficult for the baby to come in, right? But at the same time, when it moves out, it increases. So nutation is important. When the pelvic inlet decreases, the outlet opens. When the outlet opens, baby can come out very easily. And when the outlet shortens, that happens during counter nutation, that is tail goes inside and the bones come outside, pelvic inlet increases. So, understanding this biomechanics of our pelvis is absolutely important to understand what we have to do, what all exercises we have to do while we are pregnant, and what all exercises we should do in early active and transition stage of labor. The examples of posterior and anterior tilting, you can see the natural position of the labor. You can see anterior tilting, that is the hip is pointing out, and posterior tilting is when the hip is pointing in, right? So using our assessment, we can correct the posture of mother. Now, exercises in pregnancy. So there are lots and lots of myths related to exercises, that if in case we exercise, there are more chances of miscarriages, or maybe if I exercise a lot, the blood flow to the baby will decrease, or maybe the nutrition to the baby will decrease, or if in case I've never exercised, it's not the time to start, or maybe as a whole it's not absolutely safe to exercise. But trust me, it is absolutely safe to exercise in pregnancy, and we can cover up the entire area. We can do upper arms, we can do abdominals under supervision, we can do back exercises, we can do leg exercises, we can even do cardiacs, right? But yes, there are many advantages of it. So, advantages like the blood, the circulation, it gets better. When the circulation gets better, what happens is there is lots of good nutrients flow. There are lots of good hormones flow to the baby also through umbilical cord, right? You feel less anxious. There is no fear. You're not you don't have anxiety, right? And you are confident enough. When you are confident enough, definitely the pregnancy and the labor, it goes very smoothly. Yes, but there are contraindications and there are warning signs. So, contraindications can be bleeding, it can be that the placenta is too low. So we said that we'll discuss about the position of placenta, right? If you have so many earlier miscarriages, then definitely it's not good. You know, without any advice of doctor, you should not start exercising. If you are on progesterone pills, then again it's a no-no, or under supervision, or if you have an incompetent cervix. So cervix, that's the opening of the mouth of uterus. If it is not closely, so there's a mucus plug inside the mouth of the uterus which holds the cervix together and tighten it. It is very tight, right? But if by any chance the doctors feel that cervix is loose and it may open any time, so definitely they are not going to allow you to do any heavy exercises, right? So these are some contraindications which definitely you have to take care. Second is the warning signs. Suppose you've started with the exercises with someone who is not having any problem, right? But then their warning sign are like there's sudden swellings, she's very dizzy or she's nauseous, right? There's breathlessness, she's having difficulty in walking, or maybe in NSTs later in pregnancy, if there is a decrease in fetal movement or any absence, definitely these are warning signs. We should definitely stop and we should let the primary healthcare giver consult. The woman should consult the primary healthcare giver. Okay, so now the question is when to start. When to start? First 3 months you should be waiting for it. So usually it takes 4 to 6 weeks for the women to get to know that okay, they're pregnant. 12 weeks is the first level ultrasound. In the 12th week ultrasound, it is important to see the position of placenta. If the placenta is low lying or it's placenta previa, if it's placenta previa, then no, you're not going to do any exercise. You will probably ask to go on bed rest. But if it is a low placenta, then definitely you will again wait for another scan. So, approximately the next scan happens in 19th week. If still it is low, you wait for 26th week scan. Still it is low, definitely you can just guide the mother with basic stretches, upper limb stretches, and basic breathing exercises, basic back strengthening exercises. That's it. But if the placenta, it shifts towards the upper side, you can start with the exercises. As we said, that you have to check whether the mother is on progesterone pills or not, any warning sign is there or not, any contraindicated sign is there or not. Or later in pregnancy, maybe the mother is 33 weeks, 34 weeks, and she's doing exercises with you, right? But at that time, you get to know in ultrasound that the fluid inside the womb, it's reducing. We call it as that AFI, right? It's an index, amniotic fluid index. If it decreases, then definitely it's not. You should just tell the mother to consult the doctor. If there is some growth retardation, intrauterine growth retardation, again you should tell the mother to consult the primary health giver, or if in case there is any restriction in the umbilical blood flow. So these are the things when you should let the mother consult the primary health giver. So now, as we said that we should wait for the placenta, we should know the level of placenta. So what is placenta? As we said, the placenta is something through which the baby is connected in the uterus, right? So in the slide, in the first picture, you can see the placenta is high up. Can be anterior, it can be posterior. Anterior posterior यानी आगे हो सकता है uterus के या पीछे हो सकता है uterus के, right? If it is high up, yes, you can move forward with the exercises. If it is low lying, so you can see the placenta is just reaching the os. This is not a good time to start with exercises. Wait for the next scan. If still it is low lying and still 2 centimeters away from the os, then yes, you can start with a few exercises. But then, as we discussed, placenta previa. No, it's an absolute no to move forward with placenta previa. Now, the types of exercises that we can assist the mother with or help the mother with, all kind of stretches. You have assessed the posture of the mother. You know that mother is either she has rounded shoulders, or maybe she is having extended shoulders, or maybe she is having a posture with extreme pelvic tilting, right? Or maybe she's just shifting her weight to one side. So assess the mother for the posture and start these stretches accordingly. Important is upper limb and lower limb stretches, right? So, some things, your trap spasm, this is something that usually happens, it's very common in the mothers. So, you can go for the neck stretches, right? Um, Arm stretches, carpal tunnel syndrome, it's very common. So, you can move forward with all the stretches of the arm, right? At times, she may have some tingling sensations in the arm. For lower legs, she might have the episodes of calf cramps. It is very important for us to tell her to drink more water and go for calf stretching exercises. So, depending on which stage of pregnancy she is, you can modify the calf stretches and you can tell them from basic uh, toe pulling, like you are lying down and you just place one a towel and you just pull your toes towards you, to standing the general calf stretches. You can teach them everything. Strengthening upper limb strengthening. Yes, it is very important for us to focus on upper limb strengthening also. Usually, there are many people who focus on back, pelvis, and lower limbs. But upper limb strength is equally important. So you can go for 1 to 2 kgs of dumbbell. Chest training is important because finally, post pregnancy, she has to hold a baby and she has to breastfeed the baby, and maybe she has to hold the baby every 2 hours for half and half hour each. Right. So focusing on upper limb, upper body strength is again important. The second type of strengthening is definitely the back and abdominal. So, yes, you can move forward with abdominal strengthening also. But if the woman is already exercising with you and she is having the experience of exercises and under supervision, she can move forward with some planks also. As I said, under supervision. Back strengthening, glute strengthening, and lower leg strengthening. The entire strengthening protocol can be followed for the mother who is pregnant. And cardio, right, aerobics or modified pregnancy aerobics, obviously not the jumping jacks and all, right, but they are safe in pregnancy. So you can actually make some sweet sequences of different exercises and you can let her practice all four exercises. The exercises like cat and cow, alternate hand and leg raise, these all are again very important for her. So there are some pictures of exercises which you can see and relate to, and these are absolutely safe and can be done with supervision. So stretches, some squats, all for exercises, planks, as you can see, yes, they all are safe and can be done, but as I said again, under supervision, and once you're absolutely sure that medically you are on a right way, there is no complication and there is no nothing, no warning sign, right? So these are again some exercises on the mothers that we've done, which are again safe. We can just see the other, position. The woman in black who is keeping her knees on a pillow and she is tilting. So this is again modified child pose, right? With the balls, you can do many exercises. There's some planks the woman doing. There's some downward dog exercises in child pose which the woman is doing. So these all exercises are absolutely safe, and it is also good to women when they're pregnant. There are lots of hormonal, changes that are going on. If she is with you, she has a support. If she is with you, she can open up about her concerns. If she is with you, she feels loved and cared about. So, um, that is something as a woman we can support others. Now this was an overview or brief about what we can do in pregnancy. It's not all, it is a vast subject, as we said. Having knowledge of biomechanics, again, we have just covered just one part of it. You can really move forward with many kind of different protocols, strengthening protocols or stretching protocols for a woman. Now, how to support the woman in labor? Before that, let's talk about hormones in a very easy way. What I have just presented here. If you have high progesterones, low oxytocins, it maintains the pregnancy. But when the oxytocins in the body increase, it initiates, and during the labor, the important hormone that we require is definitely oxytocins, right? And when oxytocins are in our flow, endorphins are released, and endorphins are our nature's narcotics, right? They are the natural painkillers. If you know what to do, if you are supported, if you are informed about the process of labor, and you know at what stage you should expect what, and you know that you are having someone to support you, the things can be easy. Oxytocins are love hormones, so it's important for you to be relaxed. When you have the information, you're relaxed, you're happy, there is again increase in oxytocins in your body, and what happens is that the nature's narcotics that are those are released in the bloodstream, and we feel less pain. So yes, labor is very painful, but it is manageable. So these are some early, this is how the labor begins. The uterus, it starts contracting slowly and steadily. The baby gets inside the pelvic cavity like this, right? In the active labor, you can see it's almost there in the pelvic cavity, and in transition, what is happening, that baby is trying to come out of the pelvic outlet, and this is the pushing stage. So let's just talk about first, before knowing how to help a woman in labor, it is important for us to understand what are different stages of labor. So stage 1 is basically wherein your cervix, it starts to soften and dilate. So effacement and dilation is what happens in stage 1. It starts from 0 to 10 centimeter. Stage 2 is delivery of baby, and stage 3 is delivery of placenta. Excuse me. So let's talk about stage 1. Or stage 1, where the cervix starts dilating from 0 to 10 centimeters. It's again divided into three phases: the early, the active, transition. Early phase is longest of all. It takes a lot of time. Maybe a woman can come to know maybe that she's in early phase, or she may not even at times come to know that the labor has begun. Okay, so the dilation is just from 0 to 3 centimeters. What is expected is that even if you come to know, and if there is no emergency sign, you can rest before going to the hospital. You can eat something before going to the hospital. You can relax. Maybe you can just take some quick nap. You can take shower. So important is that more relaxed you are, more oxytocins come into your body and you're more prepared for the work ahead, right? So your major work begins in active stage. So active stage is when the cervix, it opens from 4 to 7 centimeters, and it's a, as the name suggests, it's an active stage. The things are happening very fast over here, right? So with exercises, with proper positionings, with different coping strategies, you can support the woman to quickly cover this active stage and enter into the transition stage, right? And in transition stage, mostly the women will tend to say that she has a pooping pressure, right? So helping the woman to know that how to, use that pressure, how to push, is very important. So exercises during labor. Now, to initiate the baby's head engagement in the pelvis, what do we need is that we want the pelvic inlet to be wide, right? So we can focus on those exercises where posterior tilting or counter nutrition is happening. So in general way, how we can say that those exercises where the tail is moving in. So you can go for some half squats with hip rolled in, knees out, so external femoral rotation, deep squats with hip 90 degrees. So the position is like knees are out and heels are in, right? So this is something like this. So you can actually move forward with some exercises which can help in posterior pelvic tilting, which engages the baby in the pelvic inlet. When she is into her transition phase and now she is having this pooping pressure, right? At that time, you can help the mother with anterior pelvic tilting, which opens up the pelvic outlet, right? So these are two types of exercises that you can focus on during labor. But trust me, exercise alone is not enough. There are different coping strategies and different comfort measures that you can move forward with it. If the mother is having lots and lots of pain, and she's lying down on the bed, so possibly there's a lot of pressure of the baby on the mother's back. So again, if there is no emergency sign, and then it is absolutely okay for the mother to get up. She can move forward with some positionings. So positionings like when she's in labor, she can just bend forward. She can breathe, deep breathings, and at the time of contraction or pain, forward leaning with a bit of hip movements, or she can sway her hips forward or backward. This is one coping strategy. Positioning, forward leaning. If there's no chair with her, if there's a table, what she can do is she can support herself with the table, she can lean forward, and she can sway her hips and breathe out. Important is the cues that she is getting. If you just tell a mother that you do like this, that won't really help until unless someone is there with her, guiding her throughout. So, encouraging your five senses. So, activating all the five senses: eyes, nose. So, with eyes, you can keep an eye contact with the mother. With nose, you can tell her to take a deep breath. Do not force her into breathing that you go for, but a very relaxed and deep breathing. Third is hearing. Ears are our third senses, right? So she wants to hear. So you can go forward with holding her hand. That is touch, the fourth sense, right? So you can hold her hands, you can look into her eyes, and you can say that yes, she breathes, she's doing so good, you're doing so well and so good, just breathe out. It's a few seconds, you're doing great. So the words of encouragement is also something that she requires, right? So, activating all your five senses, positioning. As I said, she can do forward leaning with chair, with table, with bed, with a wall also. If she's moving in the corridor and she's having pain, so she can, uh, support herself with the wall and she can breathe. Someone helping her with a little bit massage on the back, definitely it helps again. Exercises that she can do is, as I said, one is squatting. Second is that they can go for lunges. So she's holding something, she's holding the hands of the partner, or maybe a chair or a table. It should not be a rotating chair, definitely. Right? It should be a fixed chair. So while in contraction, she can go for rhythmic lunges to and fro. She's breathing out, you're holding her hands, maintain the eye contact, encouraging words, and you can go for side to side lunges. Similarly, you can go for squats. So, squats, the baby is higher, baby has to engage. So, you can just roll the pelvis in and then you can go for the squats. These are your mini squats. But then later on, at later stages, you can go for deep squat. So, exercises and positioning should be done when the mother is in pain or contraction. When there's a contraction, either use any positioning technique or use any activation technique, the five senses activation technique, or use any exercise depending on what she can do. If she is lying down on the bed, she can go for taking a left side turn. If she is sitting on the bed, she can go on sitting upright or just holding the front rail of the bed and bending a little like this, right? So these are some exercises, positions, or comfort strategies that can be used during labor. But as I said, it's at the time of contraction. What should she be doing at the time of relaxation? So, the time of relaxation, it is important for the mother to gain the strength, gain the energy. So, sips of water, important. She can just lie down, go back, close her eyes, and relax herself. Because, as you can see in the slide, that in every phase, the contraction comes after few intervals. There's a contraction time, there's a relaxation time, there's again a contraction time, so there's a relaxation time. So utilize relaxation for relaxation only. Do not panic, do not let her go into that fearful mode, right? Just let her relax, let her close her eyes, let her take a sip of water, and let her gain that energy that she requires for the next surge. So, this is how you can actually help a woman in pregnancy and labor. So, these are the exercises during delivery. As I said in transition, the woman will tell you that I feel that I have to poop. Okay, and we know we've seen that the baby's head, well, while coming down, it presses the rectum, it presses the area above the anal opening, right? So when the baby's head is pressing that area, it is a very common feeling for all the women that they are feeling like to poop, right? So teaching her how to push is important. So pushing is just like you are constipated and now you feel like you want to just push down so that you can relieve your constipation. That's how you have to push. So you can tell the mother to take a deep breath, tuck the chin to your chest, support her head, and by closing her mouth, you can ask her to put the pressure down. So, piston go down breathing or a pushing breathing is what she can practice. So, if you want her to practice initially, you can ask her to take a deep breath, Hold the breath, tuck the chin to your chest, and blow out. Do not ask her to practice pushing in pregnancy. So, this is how you can actually make a practice with breathings before the labor time, also. Support, encouragement, the support of all the loved one, be it the caregivers, be it the family, is something that a woman seeks at the time of pregnancy and labor. And we are in such a profession that we can really help those women who actually need us in a very happy and in a comfort way. So this is what we can do in labor. So, as we said that in we in labor we want the baby should engage nicely. So, post 36 weeks, you can actually focus on posterior pelvic tilting exercises. But this doesn't mean that you just have to focus on one part. Strengthening of all the parts, the perineum area, the back, legs, it's important. But yes, if you're doing other exercises in the repetition of 5, maybe you go for 10 repetitions of these exercises. Right? So this is all for today, an overview of labor and pregnancy and how you can support women in pregnancy and labor. Thank you.
Thank you so much, Dr. Manishika. I, Dr. Richa, on behalf of Physiotherapy Department, Dolphin Institute, and State Head IPWC Uttarakhand branch, extend my heartfelt thanks to you for sparing your precious time from your busy schedule. You have given such a wonderful knowledge about labor and role of physiotherapy during labor. Thank you so much, ma'am, and thank you,
Thank you.
students, for your patience. Thank you all. Any queries? Students, if you have any queries, no, all have understood very well. Okay, Dr. Manisha, thank you so much. Bye bye. Happy Women's
Thank
Day to all.
Happy Wednesday to all.
Okay.